Welcome to Therapist Spotlight.
Hello everybody, welcome to Anta's Therapist Spotlight, the podcast where we aim to showcase our wonderful members to the wider community. I'm your host Joshua Brooks, and tonight we've got a really wonderful guest, Ana Wagneck. And Ana is a remedial massage therapist that specialises in oncology massage and lymphedema as part of that whole cancer treatment and the effects and the chronic conditions afterwards. So this is going to be an excellent conversation. Ana, how are you?
Good, thank you. How are you? Thank you for having me.
It's our absolute pleasure. So, first question, how did you get into natural health?
I guess I've always been a caring person, always very very curious how the body works and the effects of stress and body muscles. And after that, I decided to go to uni to do a physiotherapist degree, actually, back in my country. So I work with that for a few years, and then you have the opportunity to move to Australia due to my husband's job. Then I also stopped working in the industry for a few years when the kids were little. And then I decided to do a training course in myotherapy. And for that, I did the Remedial Massage course as a step up for that goal. But guess what? I just fell in love with remedial massage and all the results I get from that. Like it's not just about treating the clients, the muscles and their muscles issues, and then it's much more help them get along with their lives, and the stress point it's very good. I have very good results with remedial massage therapy as well. So that's when I get into that.
Yeah, wonderful. And so I guess growing up in another country and possibly another little bit of a culture and then moving to Australia, have you noticed a difference in the way Australians look at natural health as compared to where you grew up? Or has that been a bit of a shift, or has it been quite an easy integration? How was that for you?
It was a quite easy integration, I think. Yeah. And then I think Australia, they are very good on the structure that you don't have as much in Brazil. In Brazil, you have more, you have more freedom to do whatever you want. Here, you have the scope of practice more rigid, but I think it's great. And then you have so many professions. Actually, remedial massage therapist is not a thing that is not a professional in Brazil. You have the massage therapist, yes, but the remedial massage therapist itself do not exist. And I think it was great because I use my background as a physiotherapist with all these new tools from remedial massage therapy and mix and match and applying to the clients. And it's been wonderful, actually. Yeah,
amazing.
Yeah.
And so oncology massage is so important because taking care of them when they're going through such a hardcore treatment as chemo.
Yeah.
It's just wonderful for them. But what got you into oncology and lymphedema? Like, what grabbed you about that and what made you interested to pursue that path with your career?
Yes, the thing is, when I started to work as a remedial massage therapist, we work a lot and learn a lot, apply into healthy bodies, more the athletes and people that does lots of exercise. But I always, probably because of my background in physio, I have more interest in people that has some frail issues or the chronic problems. And then I have more and more clients. And then I have this lack of knowledge that, so I have this client go all this process with all this medication and with scars. Sometimes they have a port. And going through, the chemotherapy can be very harsh in their bodies. So the oncology massage course give me tools to work with them. And I also can apply for any other chronic issues. I have some clients that they have Parkinson's, and I have a very good outcome from the massage. Is way more gentle, and the way you accommodate a client, it's very important. So most of them cannot go face down on the table, so you put them sideways or face up. You have to keep monitoring how do they feel, if they have nausea or if they are cold, or they have a different response. And then 1 week after, when they come back, you see how much they improve. Sometimes they need less pain medication. They sleep much better, and they, help them go through the treatment.
And so I guess what I would ask for the community at large, maybe, who don't necessarily understand what the remedial massage therapy can do for someone going through cancer treatment, what is the goal that you're working with your clients? Is it the same sort of goal as a normal remedial massage therapist, or are you trying to do something different with the tools that you've got to get them on their health path? What's sort of your aim with your treatments as you're treating these people with these chronic conditions?
The goal is they feel better.
Yeah.
On that week. It's like a short-term goals. It's not like a normal someone that's healthy that have a long-term goal. So the goal keep changing as we go as well. Yeah. Like can change from 1 week to another. And they will come with different side effects of the medication, for example. And then you pretty much go from that. So always going to have like an interview, sit with them and say, okay, how's your week been? Are you been sleeping okay? Then they have the neuropathies, and then they have like out of the blue some muscle pain that they didn't have the week before. And then chemotherapy also has a cumulative effect. So the first few weeks, I'm feeling fine, and then you do pretty much the same, but then they start getting more effects along the way. And then you have to prepare them, for example, if they are going to radiotherapy and had a breast cancer surgery, and they also have cording, which limitates their the range of movement of their shoulder. And normally they put the arm up here for receive the radiotherapy treatment, and they cannot do that. So you work on that so they gain the range of motion to be prepared for the treatment.
Yeah.
Yes.
And what do you mean by like lymphedema massage for people who don't know? What's that treatment entail, and what are we doing with that treatment?
Lymphedema, it's a chronic condition. Then it's very common after they remove or have any damage with the lymph nodes. So what we treat is a range of things. So ideally we have to decrease the size of the affected area because of the swelling. So to do that, you have bandages, you have laser therapy, you have pump therapy, we have taping that's been working like magic. Very interesting.
Yeah, wow.
So yes, you do the manual lymphatic drainage as well. It's a lot about education for the client and for even for the surgeon, because the surgeon has time to treat the cancer, for example, not to treat the lymphedema after. So we pretty much have this communication between the professionals to help the client to get better. So then they have exercise. We prescribe garments, the compression garments. They have more and more technology and new garments and new fabrics. It's been, there's a lot to do, and it's very interesting and challenging.
Yeah, wonderful. And so how would a remedial massage from you look different for the cancer patients, or if you're doing lymphatic drainage, to take in mind their frail stature, so I'm assuming that it won't be quite so hardcore and digging into the trigger points that you would see from like a sports massage. How does that change given that your client's frail sort of status? What sort of tools and techniques and that do you use when you're treating those clients?
What I use, it's a very gentle techniques.
Mm-hmm.
You're right, you don't trigger point them.
Yeah.
It's to make them feel more comfortable. One of the aim of stress and pain is a rich relaxation response. So the pressure that you do in the client is very gentle.
Mm-hmm.
For the manual lymphatic drainage is also a gentle one, but you can dig a little bit more because you just have to guide the fluid for the right place for the body to eliminate that.
Yeah.
So it's way more gentle, way more calm,
mm-hmm.
and lots of communication between the clients and me. And how do you feel now? How do you know? It's like it's the same. I can use that techniques for someone that have multiple fractures, for example, and then you have a leg with a problem, then an arm with a problem, and then how you're going to accommodate them to get comfortable on the table to receive the treatment.
Yeah. And so when you're doing these fluid drainage or treating with cancer, what sort of side effects can you see? Or do you find that this helps ameliorate the side effects from their treatment? Or can this like we're building these up, so if people come to you, how do you tell them that the treatment may affect them in the future? Because obviously it's going to help them get better, but they may feel more nauseous, or they may feel tired, or they may feel sore. What have you found with that kind of thing with your work?
Yes, for the ones doing the cancer treatment, normally they feel much better.
Yeah, wonderful.
They can have. We have to deal with the fatigue as well. So if I do too much with them, because for some clients it's a lot to drive to the clinic, go there, do the massage, and come back home. Is a lot for them to do this in one go. So sometimes you have to deal with that and reduce the time of the treatment.
Yeah.
And then they just gonna probably is the tired, but also they reach this relaxation point that they're gonna sleep better. And that's one thing that's gonna help the following day.
Yeah.
With the lymphatic drainage, they can feel a bit off the next day. But this is just the first one. Once they get used to that, they feel better. But the benefit is so great, because if you have a lymph, for example, full of fluid, gets the muscle tight. You can have infection from that. So even they feel a bit off the following day, they're gonna feel the balance feeling much better, and a bit off doesn't really matter. Yes, and then I always make sure I measure them in the affected area in the beginning of the treatment and the end of the treatment, and they can see straight away how many centimeters is less from their lymph. It's wonderful, actually.
Yeah.
And yes, and then you have to guide them to do the right thing at home as well. About the education, about the exercise, and yeah.
And so even if you don't have cancer or one of these chronic diseases, people can benefit from lymphatic drainage as well, can't they? Just by going and getting a lymphatic drainage massage from a practitioner. Oh,
yes, they can. They really can benefit on that. So, but the results are not so clear, like it's not so obvious. It's just very gentle results.
Yeah.
Like the clients, I feel nothing. Maybe they go more often to the toilet for urinate, but it doesn't mean they don't really notice in a general life. It's just very gentle difference. And once you have a chronic problem, the difference is just dramatic. Yeah.
Yeah. And so since you are dealing with these people with quite compromised immune systems, with quite on a lot of treatment, How do you modify your oils or your mediums or anything that you're using with your clients? Do you have to take very special care? Do you get medicated oils from a doctor to use? How does that sort of look when you're actually treating your clients?
Yeah, that's a very good point. We try to use the oil that it's no sense because of the nausea, and that can trigger headaches. This is not just for the frail clients, but for the clients in general. So we use one that do not gives allergy or never did so far, but I'll always be very careful, and then I'll always explain that one. It's a very neutral one. Nobody gets allergy so far, but if you have anything, just let me know, and then you can swap. But you tend to use the most clean and pure oil, and normally is based in apricot oil.
Oh, right.
Yes, and then you try to avoid the oils that have more chemicals, because they all go through your skin. And so you just really did a good research. Another good oil is almond oil, but that one is a little bit, the scent is strong, so some people cannot, doesn't like that one. Yeah, and that's what we use, this kind of oil. And for the lymphedema treatment, there's no oil. It's just hands-on, especially because they're going to tape them by the end. So normally I do all the manual lymphatic, no oil, and then I tape the client by the end, and they go home taping. And the taping helps to keep draining for the next few days.
Yeah, wonderful. Beautiful. And so with your own practice, are you just seeing chemo patients and oncology patients and lymphedema patients, or do you see general people as well? How do you merge that with your own practice yourself?
No, I see general people. It's especially because if you think in lymphedema, many people think they don't have lymphedema, or they have something. And then we start to have a look and see, oh, maybe you have lymphedema, and start treating them and have the results. But I saw all kinds of clients. So I do athletes, like people like runners, people that does exercise, people that have an accident, or just, people that work in the computer the whole day, or have a stressful time in their lives. And all the kinds of normal people as well.
And so would you say for like the lymphatic drainage and that kind of thing, if you are an athlete, to say, for example, if you're a runner and you've all of a sudden got swelling in your ankles or your knees because you've been training really hard, or if you've got something like that, is that when you would go and sort of see lymphatic drainage for you as an athlete? How would that work? Like, and when would you sort of say, what are the signs for people that are listening to this if they think, well, I may have lymphedema, I think I've got some swelling on my lymph nodes? How would you tell, or how would you like encourage people to come and see you if they think that this could benefit from them? What are you sort of looking for?
Nowadays they have lots of research about athletes and recover from training and manual lymphatic drainage. And they have also the pumps that the pneumatic pumps that drains the fluid as well. Is just more for recover. And that's one thing that you can apply. And other people, we have a Lipoedema, which lymphedema came from the fat deposits in the body. So this is pretty much a genetic illness, but people just label as overweight problem. So it helps with diet and exercise, yes, but they need to treat the lymphedema. And that's a kind of clients that takes forever for someone to realize they have another problem on top of their overweight, or, so it's, that's other things going on. You have the ones with edema itself that comes from circulatory problems, and they do not realize they have a lymphedema on that until they're going to have an infection. Because if you do not move the waste of the fluid that's static in one place, you're probably going to have a deep infection, and this is a serious condition. And then probably they're going to have the infection first, go to the hospital, they say, oh, maybe you have a lymphedema. You have to see a therapist for that.
Yeah, excellent. Well, we've just come up on time. Thank you so much for coming on, Ana. It's really amazing.
Yeah,
where can people find you? Where's your connections? Where are you located? Where's your clinic?
Yes, I'm located in Brisbane, and the easiest place to find me is through my website. It's called vidabodytherapy.com.
Yep.
And there I have my email, my phone, and the place I'm working at the moment. So go to the website. I have all the information and my work. Yeah.
Yeah, wonderful. Well, anybody out there who's in Brisbane and thinks that they could very much benefit from some lymphatic drainage, or think that they may have lymphedema or are undergoing some sort of oncology process at the moment, please check out Ana. And as always, the contact links will be underneath. But we'd just like to thank you so much for coming on Therapist Spotlight today, Ana.
Thank you for having me. It was great.
Yeah, it's been absolutely wonderful. For everybody else out there, have a great day, and we'll catch you all next time. See ya.
Thank you for listening to Therapist Spotlight. If you would like to know more about ANTA, visit us at www.anta.com.au.